Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Welcome to the podcast. I am honored to introduce a true pioneer in the field of health and wellness, Dr. Bhanote. As a visionary founder of Wellkula, she is a quintuple board-certified physician, best-selling author, and globally recognized expert in integrative lifestyle medicine, functional culinary medicine, and cytopathology. I'll have her explain that later. Dr. Bhanote's work is an inspiring blend of ancient wisdom and modern mind-body science. Her dedication to plant-powered nutrition and groundbreaking research into gut, brain, and cellular health has redefined our understanding of the microbiome and the role of inflammation management in achieving longevity. Through her speaking engagements, best-selling books, and insightful contributions, Dr. Bhanote has empowered countless individuals to transform their lives. Her mindful, science-backed approach leads to comprehensive health, mental clarity, and a profound sense of well-being at the cellular level. I'm thrilled to explore her journey, her innovative perspectives, and how she's helping others unlock their full potential. Let's give a warm welcome to Dr. Bhanote. Hi, Doctor.
Thank you so much, Ginger, for having me on today, and I'm looking forward to our conversation.
Excellent. All right. So tell us a little bit about your professional background. What led you to the world of functional or integrative medicine?
Yeah, so I've been in healthcare for close to 3 decades, in somewhere in the wellness space, hospital space, health space, and originally training in internal medicine, actually. This was many, many years ago, back in, I would say, late 90s, early 2000s, going in, seeing patients in the emergency room, seeing them in the clinics for follow-up, or seeing them on the floors. And I'm like, okay, I'm doing what I'm supposed to be doing. I'm trained to do this. I've found their diagnosis. I know exactly what to prescribe to them, and they should get better. And then this is the days when we didn't really have EMRs or electronic medical records. We had handwritten notes, right? So I would see patients come back a few months later, and we'd go to medical records, get their chart, pull it out, and be like, oh, here's my note again. And I don't have the typical doctor handwriting. Like, I actually, like, it looks like a typewriter, my handwriting. So everybody always loved my notes. But my thing was, I'm like, why is everybody not getting better? Like, why am I seeing these people month after month? And, and partially it's, compliance with medications is for some people, it's very difficult. But at the same time, when we are not educating our patients and we're just basically bringing them in, telling them to do this, and then they go home and they might not feel good on it. They don't understand why they need it. They don't understand the importance of it. People aren't really getting better. And so from internal medicine, I dived deep into pathology. And I had a very good foundation in pathology during my medical training. And pathology is really the study of disease. Like, why does disease develop? What's the etiology of it? Why is this happening? And what happens on a cellular level in the human body? And most people are like, oh, pathology is dead bodies. Like, no. It's everybody's alive except for, there's the forensics pathologist. Yes, those. But that is not what a normal hospital-based or laboratory-based pathologist does. So I delved into pathology, which I actually have 3 specialties in pathology. And that's 3 out of 5 of my medical board certifications. One is anatomic pathology, and that is looking at body tissue. So say you go in, you get a colonoscopy, and they take out a little piece of tissue looking for polyps, or you go in and you get an upper GI because you've got some kind of reflux or gastritis or something, and they take out a stomach biopsy. Or you go in and you get a mammogram and they're like, oh, we see something, we need to biopsy it. That biopsy goes to the pathologist. That's just the entry point. That's anatomic pathology. Now, all of those lead later to much bigger surgeries, resections, like lumpectomies, mastectomies, lower anterior resections, all of these, right? So at the end of the day, a pathologist is a doctor's doctor. We're the people with the answers. Like without us, you don't really know what to treat. So that's anatomic pathology. Then we have clinical pathology. So clinical pathology is all the blood tests. So think about like, you know, your CBCs, your chemistries, your pretty much any blood test. But then also think about blood bank. Like if you're a surgeon and you're like, well, I need, you know, 2 packs of this red blood cells because I'm operating on this person for this surgery. Like we're the ones who are one approving it, but then also making sure there's no transfusion reactions. So the clinical side is another aspect of it, and that dives a little bit deeper. And then there's one more aspect, and so that's kind of like, I would say, the bread and butter of pathology. Like some people just do anatomic, some people just do clinical, some people do both. And then many are fellowship trained. So with that, one of the fellowships I did was in cytopathology, which I'm also boarded in. And I did that in Cornell on the Upper East Side. And that is looking at individual cells under the microscope to give you a diagnosis. So this is how cool this is that I can literally put a needle in your thyroid or in a lymph node, like an enlarged lymph node, or, you know, if I'm doing it with a radiologist and say the radiologist is putting a little needle into a liver or a parotid gland or lung or, you know, different things. And they take out just a few little cells in this needle and they give it to me. And I do what I need to do. I look at it under the microscope and I go, yes, this is cancer. No, this is not cancer. This is inflammatory. And that's what we're basically giving you answers. And no real diagnosis is made without pathology because you need that some kind of tissue sampling. So I was doing that for many, many years, like, and I still do that. So I still do that many, many years. But what I found was that, you know, we definitely have an issue with cancer here in this world. And so part of being a pathologist is you're sitting in tumor boards, and tumor boards are conferences where, you know, you've got the surgeon, the pathologist, the radiologist, the oncologist, the
Yep, my husband goes to those.
yes, so you know
I'm
that, right?
familiar. Yes.
A handful of those. And a person's case gets presented, and here's their diagnosis, and the pathologist goes, okay, this is what we saw. Here's your margins. Here's this. Here's that. The radiologist goes, okay, this correlates. Then the oncologist goes, okay, according to the NCC guidelines, this is what we're going to do. And then radiation oncology, you know, so there's a whole system in place. Okay. Which, you know, once again, you think you're doing the right thing. You're like, okay, we've got it. We got answers. We know what next steps are to do. But then it's like, why are people coming back with cancer again 5 years later or 10 years later? Or, you know, forget about, like, we can't forget about cancer, but even that, like, say somebody who has reflux and is on proton pump inhibitors, which is very, very common. And they're checking them sporadically, or actually not even sporadically, routinely for Barrett's esophagus. And he's coming back, he still has Barrett's esophagus, still giving him PPIs. And eventually he develops high-grade dysplasia or he develops cancer. But why? And that's where that whole lifestyle perspective comes in, because we built this system around medicine where a patient trusts the doctor and goes, all right, this is what you're giving me is going to fix me. And they don't go on their own and change anything else in their lifestyle because they think the medicine is fixing them.
Right.
But that's not what medicine does. Medicine addresses your symptoms. So yeah, your symptoms could be better, but it's not reversing the disease. Your disease, as long as you're living that same lifestyle, will progress, maybe at a slower rate. And that's where I was kind of looking at it. I'm going, well, wait a minute. There's nobody sitting in our tumor boardrooms talking about nutrition. There's nobody sitting in our tumor boardrooms talking about their mental well-being. Like, are these people, like, do they understand what's going on, or has it become so commonplace to go, let's just cut body parts out of you? Like, I think about it, like, oh, I've got gallstones. Okay, let's go just take the gallbladder out. Like, hello, do we think about the consequences of not having a place to store bile and how you might not be able to eat the way you were eating before because now you can't break down that food? So
Mm-hmm.
these are all the things where, once you've kind of been in a space where you've been working so long, you're like, all right, something kind of feels off. I mean, maybe not everybody does
Oh,
this, but
yep. A lot of doctors have said the same thing. That something's off. Like there's a missing link.
yeah.
What am I missing?
I think at the heart of it, as physicians, we all just really want to help people. We want to make them better. And we're like, but why isn't this working? This is what the textbook told me to do, or this is the guidelines. And it does. It becomes frustrating for us because we're like, are we failing at our job? What are we doing? Is it, we're failing this patient? So that's where I then progressed further in my training and trained at the Andrew Weil Center for Integrative Medicine, which integrative medicine is, to me, is like the umbrella of how do we merge, allopathic care with complementary care and kind of put it together. Because integrative medicine is not alternative medicine. It is looking at the best of all health systems and what does this individual need, which is why I love it so much, right? And so with integrative medicine, underneath that, kind of one of the branches of that, I would say, is functional medicine.
Gotcha.
Which functional medicine is just a little bit more, I guess, in the world trendy. But integrative medicine to me is really holistic care because you can use functional medicine, you can use Ayurveda, you can use allopathic, you can use traditional Chinese medicine, but now we're making it a more patient-centered focus.
Love it.
So, and then that wasn't enough, it's never enough because I'm like, all right, I know it's the food. I know it's the food. So, and in Ayurveda, we do believe that all disease starts in the gut, just like Hippocrates thought. So then I went and trained in culinary medicine and really looking at the relationship between food and disease and how certain foods can help support the disease. Some certain foods can put us into that place of disease, and which ones really based off of the science. And this is where it got really interesting because then, people ask me, what are your dietary patterns? And everyone has their, this versus that. And let's just say I made major lifestyle changes because I know.
Mm-hmm.
Yeah.
And how many years ago did you start actually practicing functional and integrative medicine?
I would say now it's been not that long. I would say 6 years.
Okay, well, that's quite a
Yeah,
while. I
yeah,
mean, that's
not
quite
that
a
long.
while. I mean, a lot of physicians are still, considering if this is something they want to look at. So yeah, you're ahead of the game. And you had mentioned, what kind of inspired you. And then you touched a little bit on your personal life. Can you share with us, like, how has practicing functional and integrative medicine influenced your personal approach to health and wellness?
Yeah. So when it comes to my personal approach, for me, my professional life and my personal life are one and the same, right? So what I do in my personal life, what I eat, how I move my body, how I sleep, all these different things is exactly what I'm talking to my patients about. And I think that is a very, very important aspect of healthcare, is that patients want to be able to trust their doctor. But when you're sitting across from a doctor and that doctor doesn't look so healthy themselves, it does definitely make it very hard to go, oh yeah, I'm going to go do this. Right. And I think of this from the perspective of, I still am in the hospital every now and then. And, I love doctors' lounges. There are some, if I could just put like a webcam on me and walk around in a doctor's lounge, some of the stuff that happens in there is like the most interesting thing. You can be sitting at a table having a meal with like a cardiologist, and what are they having for breakfast? They're having their bacon, their sausage, their, all this stuff. And I'm going, okay, all right. And then you can be sitting across from an oncologist and, a lot of these hospitals, depending on which one you're in, have fresh cuts of like, I don't know, whatever meat of the day it is, like, carving stations, they're called carving
Okay.
stations. And sitting across from an oncologist who's basically, has no understanding of the connection between food and cancer. And that's where I find that it's really interesting. And I think having you don't just talk the talk, you live it too, really comes across to patients. I think nowadays it's not like just, oh, you have a white coat and you have this training. And like, I think patients are definitely becoming smarter and more discerning about who they want to work with, who they want to listen to. And I think for any of the practitioners listening, it's not just about like having a credential anymore.
Agreed. Yeah. I always jokingly say, the health coaches that, are overweight, it's kind of like, well, maybe you might want to get in shape first before you can become a health coach, right? And I think you're right. For a long time, the white coat kind of covered that up. And people are like, you've got the white coat. I don't care what you look like. I'm going to listen to you. But I think that is changing and people are, being more discerning. So that's an excellent point that you brought up. So can you share a story about a patient whose life, and I'm sure you have thousands of them, but one that really comes, that is a heart space, for you, a story about a patient whose life improved significantly using functional and integrative approach?
Yeah. So I'm thinking of this individual, young, well, what I define as young, so in the early 50s, also a healthcare practitioner herself, not a doctor, but in the health field, so around that space. And she was really suffering from, poor lifestyle choices, not overweight. So this is not an individual who's overweight. Actually, she's probably, and not even particularly underweight, just an average weight. So it wasn't a weight.
Like me, like 10 pounds over, you'd like to lose that extra weight, but
average weight,
I think
right?
we all have that, right?
And
we're all always a work in progress.
she was experiencing a lot of a brain fog, okay, and severe fatigue, and just mood issues, just not herself, and she knew it. And so she found me and we worked together, and we took a root cause approach, really looking at what's going on at the cellular level, from the functionality of your cells. And me, for the person who I am, who loves to look at cells under the microscope, I'm like, we're going to look at it from that clinical pathology perspective, meaning like, what do your blood tests actually show? What are you deficient in? What do you need? And I remember, because her doctor wanted to diagnose her with Parkinson's. And I'm like, no, I'm sorry, not Parkinson's, Alzheimer's. And I'm like, I really don't think you have Alzheimer's. I really don't. And they're like, oh, well, they think it. And I'm like, well, what's their definitive test for it? And she's like, well, they didn't do one, or like the results weren't conclusive when she did finally have it. And I'm like, yeah, I don't really think you have it. So let's go through my process and go through all the deep dive testing and whatnot. And of course, we found that she was extremely malnourished, in the sense of like, no wonder she didn't have energy. She had like no B vitamins, right? So, I mean, she didn't have anything for her mitochondria to produce energy. She also had a severe gut imbalance from years of eating poor hospital food, working in a hospital and just eating whatever's in the cafeteria and whatnot. And she also happened to have bacterial overgrowth, as well as a parasite.
Oh boy. And
all things like not even thinking of, and honestly weren't even tested by her neurologist. Right? That was the other part. None of this was even tested by the neurologist. That's where I think
that's not something they traditionally test for.
No,
right? I mean,
and
I always say it's not that they don't care, or that they don't want to. It's their ignorance. They aren't trained in anything other than what they're trained to do.
Yeah, exactly. So once we kind of put this all together, and we were able to treat it by, restoring her microbiome, by really targeting her nutrition. She basically says, you just gave me my life back. And you can imagine a person who has like just felt like everything's been taken from under them, like they can't take care of themselves, they can't do this and that, where you taking an integrative, holistic approach and really looking at everything can really give a person their life back.
100% life changing.
Yeah.
That's awesome. All right, so now we're going to dive into the business a little bit, because I know a lot of MDs and DOs are struggling with, how do I integrate in this to my business? How is it going to impact my financials? All of those questions. So, I'm sure adopting a new approach brought challenges for you. What challenges did you run into, and how did you navigate them?
Yeah. So I think the biggest challenge was shifting patient perspectives. Okay. And what I mean by that is patients are really conditioned to have a quick fix, a pill for an ill. Right. And it's funny because I always joke, I'm like, I'm not a drug dealer. I'm a fruit and veggie dealer. So if you're
Uh,
coming to me, you're not getting drugs. I'll give you a prescription of fruits and veggies. But, and I think that was the biggest challenge, because we are in a society where it's like, okay, you go to the doctors, you walk out with a prescription, and my
mhm.
prescription you walk out with is a lifestyle prescription. I think that was a challenge, obviously educating patients in the healing process to know that, sometimes you might need a medication. I'm not saying you don't need medications, but that doesn't prevent like all the other stuff that's going on in your body, and realizing that whatever health condition you're dealing with didn't develop overnight, so you can't expect it to be fixed overnight, and that it's a process, like peeling back the layers of an onion. I think so from that patient perspective, that was really, in the beginning parts, a little tricky, because that's what most people are used to. I think that from a business standpoint, from a physician standpoint, the hardest challenge is really insurance. And because most people are used to, oh, I have insurance, so they expect to be able to pay with your insurance. And when we step into the integrative functional space, we don't have the reimbursement set in place where we can accommodate for our 2-hour long visits,
Right.
so having that sometimes can be challenging, because people are used to, well, I pay insurance. But when you think about it, and this is a tricky part, because I even talk to patients about this, and I'm like, yeah, but do you ever, question when you have to pay a lawyer, or question when you have to pay your car insurance, or, like, yeah. And if you have car insurance and you get a car accident, you might still have to pay something. Right.
Right.
So I always like to frame it, insurance as like, that is for catastrophic events. It's not
Right.
for everyday wellness. It's not for preventative wellness, unfortunately, right now.
Agreed.
Um, and I think that is also comes down to educating and restructuring how we should be practicing medicine. And I think we're going to have a challenge with this in the future, because we also don't have enough doctors anymore who want to stay doctors,
Right.
right? Because their reimbursements have been cut. The number of hours they are working have been cut. So now people are kind of heading up to this. All right, well, now I'll just go out on my own, which is great. But now you're going to still have the patients who don't understand, what is telehealth. In a way, in a weird way, COVID was kind of a blessing, because telehealth is more
It
common now.
was. Yep.
Like before that, nobody was talking about telehealth.
Yep.
But I think the big picture is looking at, there's multiple business models, how will they work? Which one's going to work for you? I don't want to tell anybody that it's easy to have your own business. In fact, being a practitioner, about 95% of them in the first year fail and go back to working for somebody else. So this has got to be something that you're like, I'm going to build. I'm convinced of it. I know what I'm going to do. I'm going to work with the right experts to help me get to where I need to go.
It's an investment
It's
for
an
sure.
investment.
Yeah.
Absolutely is.
Yeah.
Yeah. Because you're retraining yourself, really, in a
Yeah.
way, when it comes to your own business.
And what do you wish someone had told you when you first started practicing this way? And you're like, geez, I wish someone would have told me
Um, Gosh, what do I wish somebody had told me? I don't know if it's something I wish somebody had told me, or more if I wish I would have been exposed a little bit earlier, in
that.
a
Okay.
sense of like, we're trained to really fit in this box of guidelines and these strict guidelines. And I think real healing sometimes happens when you integrate both the science and the deep understanding of the human body, and just trusting yourself and being able to listen to yourself a little bit more early on. Probably I would have been doing this a lot earlier on.
I love that.
Yeah.
What advice would you give to other MDs, DOs who are thinking about adopting this approach to medicine?
So the first thing is unlearn what you have learned, especially when it comes to treating symptoms. Okay. We have to unlearn that we are treating a symptom because we are actually treating a human being. Okay. That is
That's powerful.
Yeah. No, we absolutely have to unlearn that. Because honestly, it is much easier to treat a symptom. You pick the symptom, you match the drug. It is so much easier. But I think for a physician, it's so much more satisfying to actually see a person heal.
I've heard, other physicians share that their
Yeah.
friends rib them about, I just have to put a stent in and I'm done. Your job's much harder than mine. Dr. Collar mentioned that in the last podcast. So
Yeah.
it is.
I
It's
mean,
a little bit more work.
we
but
have
it's-
to unlearn these old paradigms, and we basically have to reinvent what medicine should be. I think we're in a very pivotal point where we actually can.
Love it. And then what trends in functional and integrative medicine are you most excited about? Like what's coming on the horizon that you're kind of like, oh, this is exciting stuff.
I think we are getting definitely more personalized. The science is starting to catch up. Some of the science already existed in an ancient wisdom kind of way, but here we want the research and we want the science papers and all that. So I'm really excited that that's starting to catch up. I think thinking outside of the box with healing is also something I'm looking forward to. So where we have the model of, the patient gets sick, goes to the doctor, and that's it. But really looking at it from the perspective of what are other ways people can heal. Like I know myself, I do retreats. And I think that's a great way for people to heal their body and really start tuning into what their body's needs are, right? So now thinking outside of the box of how can we help heal a person. So I'm pretty excited about that. And then, of course, like I said, bringing in those modalities, which are ancient, like breath work and, food as medicine and all that, and really bringing it more to the forefront.
I love that. And I love earlier you shared about mitochondrial health. We've been hearing a lot about, mitochondrial health, microbiome, and all of the, things, it's not new science. It's actually old science, but it's now being brought to the forefront, about getting out in the morning and having your morning sun and, things that seem like so simple and free that you could do to help yourself. Right. It's pretty cool. And then the last thing would be, if there's one message you want listeners to take away about functional and integrative medicine, what would it be?
I think understanding that health isn't about suppressing symptoms, but more about restoring balance in the human body at a cellular level. And my hashtag is kind of hashtag cell care. Cell care is self care. And if we can start thinking about the body in that aspect. I mean, I always invite any clinician to come to my office, like when I'm in the hospital, and look at pathology under the microscope with me. I mean, it is absolutely fascinating what the human body can do. So if you're cutting something out of a patient, if you're, recommending a procedure, you should know what that looks like on the other end.
I love that. Cell care is self-care. That's awesome. All right. And then, what is the best way to reach you? Please let the listeners know, because we'll have, not only clinicians and physicians, but, laymen like myself that love listening to this kind of stuff. How can we reach you?
Yeah. So my website is drbhanote.com. So that's DRBHANOTE.com. And then you can find me all social platforms, YouTube, Instagram, Facebook, LinkedIn, Dr. Bhanote.
Awesome. Thank you so much for being on the show. We really appreciate you taking time out of your busy practice to be with us today.
Thank you so much for having me, Ginger.